Heidi-ho, folks. I'm sorry you have to look at me this week because William is relaxing somewhere in rural Alberta in a cabin. And he said he'd be watching, but he didn't know if he'd had service. So this week I get to host. But here's the good news. I'm not hosting alone. I have number one fan Tim with me, which we'll see in a few moments, except I had to mute him because he talks too much. And he can't do anything about it because I have him muted. So sucks to be you, Tim. Get my notes here. What are we talking about this week? Oh, yes. I bet you can't believe it. COVID and healthcare and Canada and nurses and mandates and all that fun stuff. We're going to get into that. And I apologize in advance. We are going to have a show full of puppy dogs and kittens and maybe little babies because we have to get happier, folks, because it's getting old. But before we do anything, let's hear a word from our sponsors. The sponsor for this episode is Northern Truss, your one-stop shop for floor systems and for all your truss needs. Phone the team at Northern Truss at 250-787-3033. Locally owned and operated in Fort St. John, BC. Porno music on Mallory's ad, too.
Hey there, and thanks for tuning into the Will and Dave Show. I'm Susan, and I don't know about you, but I think that in the whole world, there's nothing as warm and comforting as a handmade quilt. And quilters the world over have wonderful stories to tell. So to showcase their stories, I host a podcast. It's called Measure Twice, Cut Once, and Other Life Lessons Learned from Quilters. You can tune in to the podcast anywhere that podcast apps are, whatever your favorite is, or you can find a direct link on my website, stitchedbysusan.com. And now, back to the show.
Twice, cut once.
Hey, Tim.
Hello, David.
Welcome to the show.
Well, thank you very much. I'm pretty excited to be on again. Like, it's almost as if I'm a regular here now.
Hey, I had to work for you for like forever and a year. I'm going to drag your sorry butt on this show every chance I get because at least one of us will have hair and look like they're wise because it's white.
Well, look at that. I tell you, I got the wiseness of many here with my white hair.
You are not home. That does not look like your house. You're on the road?
I am on the road. I left my home abode and left it to my daughter and son-in-law and my 3 grandchildren.
You're brave.
I can only imagine what it's going to look like when I get back. But no, I'm in Vancouver, actually, sitting in my hotel room.
Oh, right on.
Yeah.
I heard you ate at a restaurant today.
I did. And on our way down from the shoe swap, we stopped in a little town called Hope, BC, where we ate at a very quaint little town. And we stopped at a restaurant called Rolly's Restaurant. And you've probably seen them on air quite a bit on global news and in the media quite a bit over the last little while about how they are not checking for vaccine passports. So wife and I, we stopped in, we had a coffee, had a wonderful meal. And like I said, the way I am, I always ask questions wherever I go. And talking to the owner, she was very open, was very appreciative of what was going on. I told her that, thank you for being open and not having to check my health pass and disclose my health information with her.
Yeah.
I asked her a little bit about how things are going, and the business looked very busy. She says breakfast was just absolutely crazy. They had people lined up out the door. We were there a little later in the afternoon, but overall, she says it's 90% positive people giving, very good
Yeah.
reviews and saying this is wonderful, and 10% are quite angry. And she told me that people from right out of Vancouver are traveling out to her restaurant that have never frequented out there. And a young man from and his family came down from Logan Lake to have a steak dinner. It's encouraging to see somebody moving on. Oh,
William made
William.
it on the show.
Oh.
You didn't think you're going to get away without that, did you?
Thanks, Will.
Welcome to the show, William. The one thing I forgot in the preamble is our content advisory, which I will do now because I know William's watching and I want to make him feel like I am going to carry on his legacy. We will be talking about COVID and all things there related. And if this is a trigger for you, you should go watch a bunch of videos of lots of puppy dogs and cats, because this is not the show for you. So with that out of the way, I want to introduce our guests, Arissa and Candace. Welcome to the show, guys. I'm going to unmute you because I have you muted. Hello, hello.
Hello. Thanks for having us.
Oh, I don't know that you know what you're in for being on this show, because
well, my dear Dave, bring it on.
7. And it's like, yes, we have guests. Why don't you introduce yourselves and let us know what you guys do?
You go first, my dear.
Okay. My name is Arissa, and I am a long-term carried in British Columbia. I've been a long-term carried for 11 years, and I absolutely love my job, and I'm sad to have to leave.
And I'm Candace. I have also been in the healthcare industry for 10 years, and like Arissa and many others that you don't hear of, are very sad to lose our jobs.
I don't think you should lose your jobs. I want to say that right off the top. I don't think that's necessary. I think all of us on this show are in agreement with that. I think even William's in agreement that you shouldn't lose your job over this.
Well, we appreciate that.
Maybe expand for the listeners that are out there and maybe enlighten them as to reasons why you are losing your jobs.
Oh, dear. Well, as most of you know, if you don't know, you've been hiding under a rock. The province of British Columbia has mandated that all healthcare workers have the vaccination, the COVID-19 vaccination, or we will face termination. And I am not vaccinated.
Neither am I. I'd actually like to add to that. They've said that it can be unpaid pools and or termination. So they haven't quite decided as to what they're exactly going to be doing with us come October 12th. So we're all kind of hanging in a limbo.
Are we not already in a bit of a health crisis around the province of British Columbia? Can we afford to lose any more nursing or any type of healthcare workers by mandating this?
I don't believe that we can, no. And it's no news that our healthcare system has been short for years. This is nothing new. No, we can't. Bottom line is we can't afford to lose.
Do you have any kind of estimate or anything that you could maybe share with us? What do you feel like? Have you been talking to other nurses or other colleagues within your groups or whatever? Are there going to be many more people that are refusing to stay on and looking for other employment, or is this kind of just a very singular type thing just between you and Arissa?
This is definitely a group decision, a personal decision, but there's a group of us. Where we work, there's a 40% population that is in the same boat as ourselves. In other facilities around our city, there is 60% in one particular facility that is also in the same boat and making their own personal choice, unfortunately having to leave the healthcare system.
That's horrible. Have you heard of any doctors or anything at this particular point in time that are willing to just hang it up because of this as well?
Not interprovincial. I've seen many recordings on doctors. Actually, I do know of one doctor, and everybody should know of this doctor, or at least search him. His name is Dr. Stephen Malthouse. He has resigned as a physician, and he has downsized his life. He is located in British Columbia. I'm not exactly sure where, but he is part of physicians that are standing on this side of the fence.
I'm going to interject here a little bit because I want to get out of the. I find this depressing. This idea that our nurses and those who are on the front lines of this war with the disease, which is real, are being not marginalized as much as just are being mandated to do things that they don't agree with. Mm-hmm. And this is not a part of your education. It isn't like you have to do this in order to give an injection or to do a part of your job. This is a part of something. And I think that all of us agree that it sucks. It's horrible. It's one of the things I've been reading, is this is going across all of Canada now. I mean, Alberta is doing it now, and Manitoba, and Saskatchewan is looking at adding it. It's in Ontario, or it's in the beginning stage in Ontario. Mm-hmm. What are your options if this is across Canada? Are you going to be janitors at the local Walmart? Like,
to tell you the truth, we don't know. My option is I have an extensive industrial background. Surprise, not just a healthcare. But that would be what I would be falling upon. Right. My other experience, I've actually just produced my resume and handed it out looking for another full-time job.
Mm-hmm. As for myself, I haven't really thought that far ahead. I have 5 kids at home. I think for the time being, I'm just going to enjoy them right now. And maybe I'll look onto, into something that maybe I can do online from my own home so I can stay home with them. Honestly, I'm hoping this whole thing just blows over and this nightmare ends and we can just go back to work and live life.
Here's the thought. We're looking for a new co-host with William.
Oh,
well, there you go. Needs to get off, so you're always welcome to co-host with William. Need somebody on the other end of that show that I can do nothing then. That's way better.
With that said, Dave, I just want to touch on the option thing again.
Yes.
Myself, I have option to seek employment in another industry based on experience. Right. Arissa has the option to stay home with her children because her husband can support that. Right. Now, other people in our position don't have that option. They are being pressured against their own personal beliefs and choices into getting this injection. And I have 3 people on my mind that are my coworkers who were pressured into getting the injection in order to keep their job because they have no other option. They could be single, of age close to retirement. Right. They had no choice. So I'm very brokenhearted, feeling as strongly as I do about my own choice. I can feel for them in that circumstance, having the same choice as my own, but not being allowed to make that decision.
Right.
I feel
this is the thing that I wanted to just bring in, is that it's and I brought this up a little bit earlier, yesterday when we were speaking a little bit, is that we live in Canada. It's a free country, presumably. And I don't want to disclose disclosing your health with everybody else is wrong, let alone having to go into a restaurant to have a hamburger is just inexcusable, in my opinion. It's the governmental overreach is the problem here more than anything.
Mm-hmm. I agree.
Here's a question I have in regards to that, as I know I can hear it already on the other side, as they're saying, well, I don't want a person who's working on me in a hospital or any sort of care facility to not be vaccinated, as that's not safe. For all of us who are on the other side of that argument, I don't think really any of us are anti-vax or anti-mask or anti-anything. All we are is we want to be able to choose. Is that correct?
Pro-choice. Absolutely.
And this is, again, I know, just to touch a little bit on the group that Candace and I started on Facebook, the freedom of choice for all BC healthcare workers and their supporters. The reason we started that had absolutely nothing to do with being mandated. It had started out that we wanted a choice in testing methods at our place of work. That is all we wanted. We wanted to be able to choose which method we could be tested for COVID by, because now we're being told that every shift we have to be tested. Well, I'm sorry, and I don't know about the rest of you, but I do not want a swab shoved up my nasal cavity 5 days a week, because that's what I work. I work 5 days a week where I work. It ain't happening. And so we started the Facebook group for other healthcare workers because we thought that we should have a choice. And then it blew up overnight. And then we got mandated, and now it's blown up even more.
We've actually been censored, to tell you the truth.
Yeah, we've been censored, yeah. Go figure, hey?
Yeah.
Wow.
So I want to go back to censoring. There are 9 folks watching, and the only one who's saying anything is William, and we really do not want to hear from William all night long.
Of course we do. We have everything
week.
to say to William.
So the other 8 of you, we want you to chime in, because I'm going to throw his comments up on the screen, and we're going to laugh at him and make fun of him, but we really want to hear from other people. His first that I'll throw up here.
Ask William a question.
Is free is relative. Yeah, there are rules that we need to abide by as a society. I'm going to play a little bit of the devil's advocate, as I think he's right. There are rules, but one of those rules is the freedom, or is the privacy of our medical information.
Mm-hmm. Mm-hmm.
So let me bring that little tidbit up. And I brought this up to Will last time, and this really gets under my skin a little bit. And I get pretty emotional or heated about this, as I was the executor of both my parents. And when my mother was in hospice, I tried to get to understand what type of medication she was on. I wanted to know what the treatments were going to be placed upon her. I wanted to know a little bit more about what I could do perhaps to assist her. In order to obtain that type of information, there's a doctor privacy or a healthcare privacy protocol that I was unable, even as her son, her only son, to understand what was given to her. The only way that it was going to be provided to me, and it was spelled out very clearly, is that I had to have a POA, a power of attorney, to able to understand, to show what type of medication or what type of treatment she was having. Now, that doesn't seem right, as in the last days of her life, that I had to obtain that type of power of attorney of her for get medical attention or medical advice for her. Yet now I have to go in and I have to disclose my medical advice to and I don't mean to be derogatory on this, but to a 19-year-old waiter or waitress at the front door, and let them know that I'm vaccinated or not vaccinated. Like both the ladies said, I'm not pro-vaccination, I'm not anti-vaccination. And what William just said there kind of gets to me, because the biggest one that I always hear back is, well, freedom is a relative term. What about when seatbelts were mandated to come in? That's a little bit different. Putting a seatbelt on, I'm not injecting a drug into my body that I really have no knowledge upon, versus putting a seatbelt on to drive my car down the street. I get it, Will, but that to me is not even an argument.
In his defense, he came back with that. So, I mean.
There was one thing I was going to mention about freedom being relative. So I don't know if anybody who's viewing knows, we are active members in protesting. Now, we've said before, we're not anti-vax, we're not anti-mask, we are pro-choice. And that's what we protest, is the freedom of choice. And there's one thing that is constantly being yelled in the speakerphone of a certain individual that shows up and supports us. And he says that freedom is not free. It has always been fought for. And we have had multiple military personnel, including one man that stands with us every single Saturday who fought for our freedom. And I absolutely 100% agree with that. Freedom is to be fought for. And I think that that's what we're doing right now.
I find it incredibly sad that people forget that. People forget that our grandfathers and our great-grandfathers, that they fought for our freedom. And I know my grandfather would be rolling over in his grave right now. And I am very proud to say that I stand out there every Saturday and I protest and I stand up for my freedom, for your freedom, for my kids' freedom, for everyone's freedom. You know what? People call us selfish all the time. How am I selfish when I'm doing this for you guys as well?
Thank you for bringing that up. Like, I really think that's a very valid point that you brought up about our forefathers, fighting for freedom. And Dave, can you pop that up again about what Will just stated there? I don't think this is the right way, but people need it. Why?
Good question.
Why? Like,
he thinks they need the vaccine, and that is we don't want to get into that, as we'll be here all night. I think that our issue is if we're made to take it.
So let me bring up a little article here. I was watching Global News earlier this afternoon or this evening.
That's your first mistake.
Well, true, mainstream media. But what came up is that this individual is, and it's not just one person, it's starting to be a bit of a roller coaster. It's starting to balloon out, is that he is unable to vote in the election on Monday for the federal election because he had tested positive. Now, he was doing a call into Global News or whatever. He looked as healthy as you or I do, yet he tested positive, and he is unable, because he's being quarantined at home. Elections Canada will not allow him to vote in the election. What kind of freedom is that?
Yeah. Are you not allowed? Sorry, I've never done this before. Is there not an option to vote online?
It's passed.
Oh, it's already passed. Oh, okay.
And the mail-in ballot
online, and the mail-in ballots not anymore. That deadline is passed. So this gentleman, and then they brought in another lady out of Alberta. Her entire family tested positive for COVID, and she is unable to vote in the election as well. And like she said too, there's how many people are in the same situation? There could be hundreds, could be thousands, who knows? And yet Elections Canada will not allow any kind of voting to take place.
So I want to play a little bit of the devil's advocate on that, as William's not here, so I think I need to. So if you go out this afternoon and you are out on your ATV and you break your leg, you can't vote on Monday, as you're going to be in the hospital, and they're not going to. And so there is a little bit of an argument that says if you're sick, you shouldn't go vote. If you have the flu, you shouldn't go to the polling station. And if you have COVID, you probably shouldn't go to the polling station. I get that. It's one of the cracks that I think they fall through.
That's common sense.
Yeah.
Thank you. That is common sense. This is common sense, in my opinion.
Yeah.
Is this a relative?
You know what? Society is lacking a lot of common sense right now, unfortunately.
Yes.
I wouldn't say that they lack common sense, and don't take that offensively. I don't think that they lack common sense. I think that their common sense is being overrun by pushed information, one-sided. To slightly answer Will's question, our issue is being in the healthcare industry, and I'll briefly touch on the past. When I first started, it was 2009. It was a recommendation to receive the flu shot in order to go through with my career. I took the flu shot. I was sick for 2 weeks, and after that, I decided I don't need that in order to get through the flu. I have a natural immune system. I was very young when I started, 19 years old. So at that age, our immune systems are very strong. They can attack and kill a virus without the help of vaccinations. And that's why I'm not anti-vax. I do believe that there is a certain age that our immune systems become slower, and we need that added help. So I can see where somebody's choice might be go to get the vaccination, or in this case, an injection, to assist in that immune system. And I lost track a little bit, and I forgot what I was going to say. So maybe it'll come back to me. I'm going to read through Will's questions here and say, to save lives from COVID. Okay, so that's why he believes we should be getting the COVID-19 injection. I appreciate that. But now you have to think about what I just said about our immune systems at a certain age. Now we're talking about 12-year-old children who are being told they require this injection to go to school to protect the rest of the children or themselves or their family members. At 12 years old, your immune system is amazing. You do not need an injection to make it stronger or to protect yourself from this particular virus. And I'm not saying that COVID is not real. I've worked an outbreak. I've worked 2 outbreaks. And the first outbreak, I was unvaccinated. The second outbreak, I'm unvaccinated. And that's by choice. I utilize my PPE to protect myself in those circumstances. And I go home to my loved ones, not worried that my trained ability is putting anybody at risk.
I 100% agree with what she just said. I was going to say the same thing. Like I said, we've been doing this for 10, 11 years. We've worked through many outbreaks. The Norwalk virus, just to name one. We were properly trained on how to wear and remove PPE. So I have never once brought any virus home to my family. I have 5 kids. I wash, like they said in the beginning of this whole pandemic, wash your hands, it could save lives. Wash your hands, wear your mask. Why is all that out the window now?
Yeah, you tell me.
Mm-hmm.
There's a lot to be chewed on in what you laid out, Candace. I think that the mortality rate in the under 19 is so low to be almost zero. The mortality rate in under the 50 range, the 54 or whatever the break is almost zero.
Mm-hmm.
It's in the upper ages, which it's bad. And I realize with the new variants, et cetera, you're going to get a little bit more, but it's just, and I don't want to get into the COVID bit as it. We can argue that with our coworkers all day long.
We can argue it with anybody, really. It's been social divide for everybody lately, families included.
Yeah. Oh, absolutely.
Yes.
Yeah.
I have a son that doesn't agree with me.
What does this? How can I say it? Again, I'm watching the news, and there was a COVID outbreak at long-term healthcare facilities in the Lower Mainland here. How does that happen if you were fully vaccinated in these healthcares, and there were 6 people that passed away in this one health facility? Enlighten me. How does this work? Like you stated a little bit, is that your immune system is depleted as you get older, and I understand that very well. And that's why we're giving this COVID vaccine. We're given the first shot, we're given a second shot, and now possibly a third booster shot or whatever. Is that
Use
not
the
to
loosely, Tim?
But isn't that how we're supposed to combat this disease? Why are these people in these long-term health facilities and these, what do you call them, seniors' homes, still passing away because of this?
I just want to quickly, I know Candace is chomping at the bit to answer this, but let me just quickly say something. Because number one, think of why these people are in this long-term care facility to begin with.
Mm-hmm.
They are at the end of their life. They're there because we are keeping them comfortable until it is their time to go. And I'm sorry, that is the reality of our job. So number one, they are already there at the end of life. And number two, they have so many underlying conditions, heart disease, diabetes, things that will contribute to a weakened immune system already. Go ahead.
So, Tim, remind me. So you asked how we, if they're receiving the vaccination, why are they still coming down with COVID?
Correct.
So without going down a rabbit hole, which Dave had mentioned, is very easy for any of us to do, especially on a one-sided biased opinion. And I will admit that I have a biased opinion of the COVID-19 injection. And my belief stems from research. So I was listening to a doctor speak about something I was interested in learning. And he said something that really stuck with me. He says, if you do not search for it, you will not find it. And that's my advice to people. If they want information to understand why people who are getting double injections of the COVID-19 and still coming down with COVID, they should search it. And they will find answers. And we, myself and Arissa, through our support group and through our 7,800 followers that we have, we all communicate and share information. And of course, we fact check to make sure that our information is as 100% accurate as we could possibly make it. Of course, we're going to find things that aren't quite accurate. But I don't think that we should disregard the professionalism or the people in professions such as doctors or virologists or scientists who are involved 100% in the making of these injections, coming forward with information that could potentially save somebody's life. And I say that very lightly. I don't mean to offend anybody's opinion on the other side of the fence, William. They're not disclosing that information to the public. Tim, what you've mentioned to us multiple times tonight is that you watch the news. Now, on the news, you don't hear of this side of the COVID-19 injection information. You hear of the unvaccinated being a threat, or the protests outside the hospital, how demoralizing they are to the people who are actually working in the hospital and giving the COVID-19 injection to people in order to save their lives. I think that it's been masked to a point where nobody knows what to do. Nobody knows. Everybody's pressured. They're pushed in certain directions. They're sad because their family won't talk to them, or they're losing friendships, or they can't go out into the community if they don't receive this. So out of fear tactics and propaganda and the repetition of information on the one side, yes, of course, that's going to push people into a certain decision. And it's definitely going to make a larger population of like mind. I talk a lot, I'm sorry.
No, that's
Okay.
wonderful. I think it was great.
I'd rather have you guys talk than me and Tim any day. So one of the reasons you're on this show is your Facebook group. I got a note from Tim, actually. He said, hey, have you heard about these nurses? As he knew that my daughter was a nurse. And I joined the group. I called myself a health professional. And then I instantly messaged and said, hey, I'm not really. You can kick me out if you want. I'm not really.
And I said, that's okay. We'll keep you as long as you support us.
Yes. And it's one of are these groups on Facebook? They're popping up and saying, hold
Rapidly
on a minute.
all over.
There's a problem here. And why did you begin the group? And what was your hope for what it would accomplish?
So basically, the reason we started the group was because Candace and I, like we talked about before, are just two of many of the healthcare workers that work where we work that are unvaccinated and have very strong opinions about staying that way. So we knew that there had to be more. There's got to be more of us out there, whether or not people were afraid to come out. We just wanted to give them a platform where they could feel comfortable and a safe place to discuss what is going on in the world right now. And we wanted them to know that we support them no matter what their choice is. Please let me clear that up. I do not care if you are vaccinated or unvaccinated. That's not my choice. It's your choice. You've done whatever is important to you or whatever's best for your family. And I've always stated that we are here because we believe in pro-choice. We believe that we should not be pressured to do something with our own body to keep our job. And it's pretty much as simple as that. And we knew that if we came out and let other people know that, hey, we're healthcare professionals, there's got to be more of you out there. You are not alone. And I tell people that every day. People will message me. They're very upset. I feel alone. And I'm like, hey, you are not alone.
No, not at all. 7,800 people. You're definitely not alone. There's only 2 of us sitting in front of you right now, but there's a whole ton of us out there.
So on that note, I want to say that there's a series of the shows that we're doing. We're interviewing a few of these in these Facebook groups, and that it just amazes me the goodwill and support in the groups for each other.
Mm-hmm.
In the one group for BC, it gets at 140,000 members.
Yeah, it's incredible.
And it is a random, mean or nasty, like almost everything is positive. And it's so amazing that there's a lot of goodwill in people. There really is.
And like you said, like, why did we start that? And
Sean made a good point. I'm going to drag Sean into it. I don't remember his last name, so I apologize, Sean. But your group that you started for the BC businesses, you absolutely 100% nailed it on the head as to why that group was created. That is exactly why we've done it. And there was a segment there where he mentioned it was partially because of being together, unity, and pro-medical choice. And for us, that's what it boils down to.
I just don't understand why we're seeing such a division and the government pushing so hard to get this. It's almost like a reverse psychology for me at this particular point in time, is that they're pushing almost too hard. We're seeing throughout Canada and the United States even where there's lotteries that are given out, $1 million prizes. I think it was even in Washington, you could get a free joint or something, wasn't it, David? I don't know if you...
What? Seriously?
Like, yeah.
You'll be happy after. You don't think about what you just put in your body. Just have a joint.
Yes,
Chill out.
it actually, in the U.S., all depending on the state, you could get a case of beer, you could get a joint, you were entered in a lottery for $1 million. It was a jab for a joint is actually what they called it.
It's simple to people. It's simple. Oh, well, shit, I get the flu shot every year. This isn't any different. I'm going to go do this and I get a free case of beer. Yeah. I mean, how easy does that sound?
Why are we bribing people? Why are we bribing people to take a vaccination? Why?
So, William, I will save you from having to type this out because I know he's texting swiftly on his phone.
I did read that last little memo that you put up.
I don't agree with you, Will, except I'm going to say what I know you would say is that if it saves lives, we need to do it. So that is why they're bribing people.
Is it saving lives, though?
See, and that's where I would kindly ask William to do his research. Because if you look for it, you will find it. So if you believe that this injection is saving lives and that you believe that the unvaccinated are putting those people at risk, then do your research and present the facts. And I will gladly bow to you, sir. But unfortunately, I've done a significant amount of research. I mean, I could drag the show on into midnight if you really feel like it. And I could give you names of professionals that can answer those questions for you. And I would rather them say it than me say it in my own words. I would rather them tell you. So by all means, after the show, if you feel like messaging your good old dad there, he can let us know what kind of questions you want answered and we will provide that information for you. That is a very sticky conversation because we are pro-choice. We don't want to push our information based on our own choices on other people. We want them to come to us and ask them, hey, I'm a little bit weary about getting it, or I got it and I'm experiencing this. What do you think about it? And then that's when we'll provide information that can guide them through why we might think that it's not a wise decision.
Everybody is entitled to be informed, educated. Be informed, be educated, make your choice. Whether or not that's to be vaccinated or not vaccinated, that's totally up to you. But I am hoping that people will open their eyes a little bit more and do the research, because this COVID-19 vaccination is not saving lives. It's taking
and you brought it up very good there, is that to become educated and ask questions. I thought that's the way it worked, is that if you're unsure of something, you ask somebody for questions. And so many people are willing to just go ahead and get the vaccination because what they see on CNN or the Global News or CBC, the mainstream media is telling people to go get it without having to ask any questions. And that's where I come into and start to ask questions. Like you stated earlier, why are we being bribed to take this medication or this vaccination? It just seems a little odd to me. And Dave, you can bring it up, or even William. Now we're going to get into the conspiracy here again, but I don't believe
no,
a conspiracy theorist is
Were
wrong
people
if you
bribed to
ask the
take the
question.
polio vaccine?
No, and that's what I was, or chicken pox or whatever it was.
Right.
No.
Yeah. People were not bribed to take other vaccines that I can ever remember. Like, I've not been alive forever, but I don't recall ever having to be bribed to take my children for their their immunizations.
Here, William, I'll put this on. It's just for you, William, as I knew he just sent this to me.
Oh, that's funny.
One of the problems with this meme, and I've had more people send it to me, is that the information on the internet, it is not a bunch of nobodies. But it isn't a bunch of nobodies. It actually is doctors and virologists and people who do know. And when they argue with the government officials,
they're discredited.
Yes, and there is no acceptance of anybody who has a difference of opinion. And I think we're seeing it in the nurses and the doctors who are standing up and saying, I want to have a choice. There's no voice for them. And I think that is the shame, is that if it's not in the narrative, if it doesn't fit the boundaries of the narrative, we throw it away. And I don't like that, as there is some good information on the internet. It isn't all good, and Wikipedia is not a good source a lot of times.
No. People are being censored, and it's the sad reality of the world right now. People that speak the truth, know the truth, they're being censored, and
so a lot of the censorship.
Because of the information that they're providing us. My belief is the censorship is because they are on this side of the fence and they're disclosing the information that they know. So to touch on that meme, that's insinuating that everyday normal person, like Dave mentioned, goes on Wikipedia and says, look, I found something the doctors have missed. Well, my information is from doctors, is from scientists, is from the world leading virologist who has disclosed information about the research and studies on this that has helped me make my choice and helped us in this group make our choices. So the information is out there. It just stems right back to what I said earlier. If you do not look for it, you will not find it, because they're not allowing it on the global news or CNN or CTV, those big news airs that we hear about the other side of the fence. And that stems into what Arissa said. Educate yourself, become informed, and then make your decision. And that's not what's happening. What's happening is they are informing us. There is no information or education from both sides of the fence, which there always should be in any choice made, especially when it comes to your own body and medical choices. And my question, so one of our slogans for the group is support each other. What is it? Support each other, love each other, and always ask questions. And that's what we do. We always ask questions. And if they don't answer it for us, we go searching for our own answers. And it's unfortunate because our belief is if we are entitled to free choice as Canadians, and we'll touch on the Charter of Rights, etc., those kinds of things that have been instilled for years and years and years. If we are allowed to make our own choices, especially on medical choices that could potentially threaten our lives or our children or our families, we should be given all of the information. All of it. And people aren't being given all of it.
And then we can make the best choice for ourselves. But for other people to sit there and tell us that we're selfish for not getting the vaccine,
or we're endangering the other people.
But how comfortable are you in that vaccine if you have to worry about us that are unvaccinated? That is my question.
Oh, I love that. That's because that's the question that I get asked all the time. Like,
Yeah.
it's the truth. Like, you know, there's a meme out there, Dave, and maybe you can pop that one up. I know you were going to
I'll
pop
find
it up
here.
here
Yeah, I'll
earlier.
look for it. Yes, I have it here.
And when Dave sent me this meme, I had to read it 2 or 3 times to actually understand what it said, but it's really, really good. Because if you're vaccinated, then why do I have to be? Like, if you want to protect yourself, if that floats your boat, then go for it. This is a good one. Read this.
The protected need to be protected from the unprotected by forcing the unprotected to use the protection that didn't protect them.
Bravo.
Yes. Again, like, you know, and I know this isn't, I've had numerous conversations with people and they state that this is not the same, but I take my children to get their immunizations, for instance, chickenpox. Now, the reason I get the immunization against chickenpox is so that when I take my child around other children who may be infected with the chickenpox, my child is less likely to get chickenpox, right?
Yeah.
Is that not how a vaccine is supposed to work?
Correct.
So, I mean, these people do not need to be afraid. If they believe in science and they believe that the vaccine works, they do not need to be afraid of the unvaccinated.
So I kind of want to scale this back a little bit because I think we're getting into the weeds of if we should vaccinate or shouldn't. And I don't want to get into that because it's so opinionated.
Yeah,
Yes,
of course.
agreed.
Yes.
So the other night in our pre-meeting, we talked about the lack of trust in the officials, and I wanted to touch on that a little bit, as I think it's one of the arguments I have with William is I don't trust the government. I look at Bonnie Henry, and I'm not.
I have less trust now than I ever have in my entire life of the government.
Absolutely. I've never cared much in the past years to go and vote. This year was really important for me. This year, I felt the need that I needed to absolutely vote, because if I didn't vote, then I had no right to complain about our government.
Exactly. Agree. 100%. Sorry, Tim.
No, that's what I've always said. Like I'd go for coffee with somebody and they'd bitch and complain and bark about the government or whatever. I go, did you vote? No. Well, then you have no right to even discuss what we're talking about here. You know what I mean?
Yeah, I agree.
And last time I voted, I was 18 years old. So like Irissa said, this year was very important for myself. I registered and I voted so that I had the right to complain. My opinion can be heard now.
And the other one we touched on in the pre-chat here the other night was on the symptoms. And what is, if somebody is experiencing a cough, what are the odds of them actually having COVID?
Can I just quickly say something? Because this is just like, it's kind of irking me. In the last 18 months that COVID has been around, where have all the other colds and influenzas gone? Like,
they're
where
cured.
have they gone? Because every year at this time, particularly, and in the spring, I always fell to the common cold or whatever you want to call it. But heck, you can't tell anyone that you have a snivel or a cough now because you automatically might have COVID.
God forbid you sneeze in public.
So I want to know, where did the common cold go to? Where did influenza A, influenza B, where did they go? Everything is just COVID now.
So I want to say, I just have to interject this because it sort of comes to light in this. In the old days, if you had to fart, you cough to cover a fart. Now it's the exact opposite.
You just hold it in, Dave.
You fart to cover a cough because it's more socially acceptable anymore. And
yes.
It's one of the things that when I watch these like everywhere in all the businesses, every school, everywhere you go, there's a list of all the symptoms. If you have this, if you have this, if you have that, like every morning I wake up, I blow my nose. Like I think it's a part of being old. I know that Tim does because but it's one of the things that that honestly, on that list of COVID, it's one of the things on the list.
Well,
And so I
heaven
lied,
forbid
say no.
you have a seasonal allergy.
Yeah.
Like I sneezed. I kid you not, probably 6 or 7 months ago. Had a mask on. I was shopping in Costco and I sneezed, and this lady gave me the dirtiest look. And I looked at her and I said, "Oh, sweetheart," I said, "don't worry, I don't have COVID." I said, "I just highly am allergic to everything that's blooming in the air right now." Like, it's true.
If
It
I was
is
you,
true.
you'd say
It's
I'm
a-
allergic to BS, and that's what.
I didn't
The
want to get into
paranoia
it.
is absolutely running rampant. Paranoia is paramount right now throughout society.
Yes.
And we've even found that you go shopping, like nobody talks, nobody chit chats, nobody does anything. It's like people are socializing with people has gone out the window. Like, it's just unbelievable what has occurred here in the past 18 months. And then you can talk about the mental aspect and mental health, what this is doing to our children. Like, it's absolutely horrid on how they're being segregated, the way they have to be, I guess, almost corralled, and they can't do this, and they have to put the mask on, and I think we're going to have a pandemic of mental issues in years to come past this.
I think we
I
already
believe-
do. That's why the Will and Dave show is on YouTube.
I believe we're creating a lot of psychological problems for our children right now. And I've actually sent an email to my son's school. My son started high school this year. And I sent an email to his school and I said, "Listen," I said, "my son has been through enough the last 18 months from this pandemic. He is not wearing a mask. If you have any problems, you can call me." And unfortunately, my son's in grade 8 and it's a really hard year to fit in. So he doesn't want to not wear a mask. But I've told him, I said, "Listen," I said, "it is not the law. You do not need to wear a mask. And I have told your school that you will not wear a mask. And if they have a problem with it, they can call me." We are creating so many more problems than we need to be creating. And I will pick my battles, and that is not one of them.
Here, how do you make friends when you can't see somebody's face?
Well, it's huge.
I mean, I look totally different without that covering on my face. Imagine what those children are experiencing, not knowing what each other are actually looking like.
Well, you know what the best part about it is, though, is underneath the mask, I've mouthed some pretty expletive words to a few people.
I agree. Don't get me wrong. I agree. I can't
stick your tongue out at people.
I can't say what I want to say now anymore. No. Just a few days ago, I'm just going to quickly say this. Yeah. I went to Winners with my 2.5-year-old daughter, and before I got there, I was like, I'm not going to wear a mask. So I walked into Winners, and of course they have the lady at the front with the mask and the tongs, and she went to get me a mask, and I said, "Don't bother, sweetheart. I can't wear one, but thank you anyways." And I kept walking, and she said, "Okay, have a nice day." But I felt so good. I felt so good to walk in there and know first of all, I'm not sick, so I'm not going to get anybody sick. But I walked in, I said, "No, I'm good. I don't need a mask. Thank you. Have a nice day." I was polite. I'm not rude. And I didn't have any manager come up to me and say, "I'm sorry, you can't shop here." But I think people are starting to realize a little bit more now that it's not the law.
Mm-hmm. I have a family member that does this all the time and just has never yet been kicked out of any place. And he's just, "No, I'm not doing it." And good for him.
Good for them. Absolutely.
I agree. And I'm, like I said, I'm trying to raise strong-minded children that,
think for themselves.
Yes. And my daughter's 2.5 and my youngest is 1.5 years, and they know nothing but people walking around like this.
I know. Isn't that horrible?
They take the masks off, or they see someone without a mask and they're like, "Huh." But I didn't want that for them. So I told, I just said, "I'm not going to wear a mask anymore. And if someone asks me to leave, I won't create an issue or a problem. I'll kindly say, 'Do I need to remind you about the law?' And if they want me to leave, I'll leave. I'm not going to create a problem or get myself arrested with my children there." But I think that it's time that
you all heard her with her children there. So without her children, watch out.
I think that it's time that the majority of us that don't believe what's going on. I think that we need to stop testing for COVID, stop wearing a mask, stop being afraid.
That's a great question.
Let's talk
about the difference between mandates and law.
I don't know that we're the right individuals to do that. I'll have to have a lawyer on.
No, I agree. And thank you for your question, Sonia, but I'm sorry. Yes. It would be very wrong
Did you see what
to answer that.
And Brad, I want to say to you, Brad, that I know you well. You should not be allowed in Costco. They should allow your wife in Costco.
You know what I have to say about that is you should challenge them and say it's discrimination. So you can actually put in a complaint against that business.
And I heard a little story about that. Is there's a little bit of a backstory on that one that I can state, is that because it's private property, though they can institute any type of anything that they want to do.
Oh.
Like it's like, you know, you go into a, I don't know, like a gas station or whatever, and they say that you have to stand on your head in order to get gas. And they can do that because it's private property. It's like, you come into my house, you can't wear your shoes. That was the story that I heard, is that they have to, because of private property and private businesses, they can do whatever they want.
Mm-hmm.
So if that's
I've
the
stayed
case,
at your home, and when I come to your home, you make me wash the sheets. I'm wearing my shoes in the house next time.
Great.
That's funny.
And Brad, I do want to touch on this. There's a lot of people losing their jobs over the vaccination. And that is...
I'm sorry for those people as well.
Yeah, and that is the rub. And that's the reason for this conversation, is we really have to speak up, and we have to vote. For reasons, and not for hair color or for skin color. We have to vote for reasons. When you go to the polls, learn about the policies of the people that we're voting in. It is important. You know, I think in Canada, you guys are up against a rock and a hard place. As O'Toole is not really a great choice either.
No. But we touched briefly on the subject of splitting votes.
Yes.
So I think that, and of course I haven't voted in such a long time, this might not be correct, but I think that splitting votes will not help the end result with how close the two top are. Exactly. I think that we need to choose between the best of both evils. And without saying anything, I'm sure everybody knows who the worst evil is. I think that
For you, William, it's Jagmeet Singh is the worst. I just want to
Oh, that's funny.
It's really hard. I mean, I'm a fan of the PPC. I really am. And I don't think that they're going to get there. And there's a piece of me that says, you know, if there's ever going to be election and that you lose for the growth of a party, it would be this one. But it's so close that it's who wants another year and a half or 2 or 4 years of the guy who's there now, you know, and that's the hard part.
That is the hard part. Definitely. And just like the vaccination and the unvaccination, which party you vote for is a very hard conversation to have with anybody. I mean, I don't have conversations with my family about political opinions because it can go on forever.
Oh, come on. That makes great over turkey dinner.
No, I hate politics. I hate it. I never followed it until this year. And then I was like, whoa.
Well, let's put it this way. Because I haven't voted in such a long time, I've actually taken the time I educate myself on both sides of the fence. So, William, I'll let you know that. I do know your side of the fence as well as my own. I have watched all of the debates I can possibly attend on my television, and I've had to pause it numerous times to swear and yell and scream my profanities and then unpause so that I can continue to watch so that I am educated.
I'm just so happy that you do that, as I think a lot of people do not. They hear the sound bites and they hear the clip on Global or on CBC, etc., and it's not the full story.
No.
And I think it is important.
And that is perfect. I'm glad you said that, because that is what's happening with the information we're being provided about COVID-19.
It's one-sided.
Absolutely. So do your research, people. get the information. If you want it, come to me and Arissa. We have so much information to enlighten you, to help you make an educated choice. And like we've said before, we're not about to judge you or push you to the wayside because you've chosen what we haven't chosen.
It's just unfortunate that personally, I know of a gentleman that was a good friend of our family that had passed away 5 days after getting his second jab, and no underlying conditions, perfectly healthy. He was at work, worked in a warehouse, dropped dead of a heart attack. And people don't talk about that kind of stuff. People don't talk about the ones that they know that have died because of this. But I do personally know people who have. And if you think that I'm ignorant because I'm not vaccinated, then
you don't have trust in the vaccine you're taking. Simple as that. If you believe that vaccinations protect you, and like we've said before, we're not anti-vax. I got my flu shot a long time ago. I believed it protected me, even though I got sick. I mean, I didn't worry about the people who were unvaccinated around me because I believed that particular vaccination that I took was protecting me. Mm-hmm. So if you don't trust it, you should ask questions. Why don't you trust what you're putting into your body?
Well, like we said about that pharmacist last night with the information pamphlet.
Oh, yes, that was beautiful.
The information pamphlet that she had opened a unopened vaccine box and took out the information pamphlet, which every medication that you ever get from the pharmacy or your doctor will have a pamphlet.
Which is by law.
That states the ingredients, the side effects, yada, yada, yada. It was empty. It was blank. It was completely blank. And she opened a brand new vaccine box from her pharmacy where she works at and took out that pamphlet. And she said, this is why people are afraid and asking questions. This is why they don't want to get the vaccine, because we just don't have enough information.
And that's a simple question to ask. I mean, all we're asking for is the information to let us make our own choice.
So, William, I know on the couch right beside you is a pharmacist. Would you ask her if that has happened to her as well? As I know she's sitting right beside you. So ask her if she has read the information sheet on the vaccine things, bottles, whatever they come in, vials.
Do you have any suspense music, Dave?
I don't. Yeah. I just hope he's still listening. We haven't pissed him off enough to chase him away.
I notice his comments have kind of just dwindled off.
It's Brad now. We have number 2 fan Brad in. So.
Oh, I see. Hi, Brad.
Yeah. It's one of the things I want to go back a little bit. Is you were worried about losing a little bit of credibility. The fact that you're on the Will and Dave show, you've lost all credibility. I'm sorry.
That's okay. We did our research before.
Yeah. It's one of the things that I should have said this at the beginning. I want to say it again. I know nothing. I know Tim.
Even less.
He knows nothing. We have guests on who know things. And so our opinions mean absolutely zero. Hopefully our guests who we on, and I know in this case, they do know a lot more than us. And so research what they have said, search it out, and then argue after you've read a little bit about it. It's not about who's right, who's wrong. It's not about if you should get vaccinated or not. I got the vaccine as I wanted to go to Canada and visit my granddaughter. It's there are reasons. I got the Johnson & Johnson one as I didn't want the 2 shots. So this is very interesting, and I don't know if we want to go into this a whole lot because we could be here all day.
I did just read that.
Yeah, there's a lot of information.
And this is Brandon.
Yeah.
Brad or Brad?
Brandon? Brad. I'm sorry, Brad. So I'm going to say a few doctors' names on here because these doctors have disclosed themselves to provide information for people before we even knew what was going on. We have Dr. Stephen Malthouse from British Columbia. We have Dr. Mark Trozzi from Ontario. We have Dr. Patrick Phillips, who's also from Ontario. Now, those are 3 doctors that I know for sure that have information that they can provide to people about what this is doing to individuals who are receiving it. And I can't speak for them. I do know that they have information hubs. So if you were to search their names, they will come up with information that you can research yourself and come to your own conclusions.
You're muted, Dave.
Uh-oh.
That was very
David,
interesting.
are you
We will add their names and links in the
Yeah, I'd love to have that, to be honest with
shoot
you.
in the comments
There again,
after the
it's all
show.
about
Yeah,
research.
we will add that. Here's a good one from Sonia, which I think all of us, we asked early on about this one.
Doctors in the day would say it's a virus. You have to let it run its course. No antibiotics, fluids, rest. Absolutely. I 100% agree. I'm old school. Drink your fluids, get your rest, take your vitamin C, take your vitamin D, eat your greens, get your exercise. I believe that our immune systems were built to withstand a virus like this. I think that we need to rely on it. I think that we need to trust it.
Brad touches on a fact there that, yes, thank you. I agree with that 100%. And Dr. Mark Trozzi also agrees with that. He has a show or a video that has been recorded, not necessarily by a very largely recognized news feed, not one
Bigger
that
than the Will and Dave show.
yeah, much bigger. But he also he also says that, and if I may, Mr. Trozzi, if you are eventually going to see this, I would like to say something that he has said, that he was prepared as an emergency doctor of 25 plus years. He was prepared by what they told him, 10 to 20% of the population was going to pass. And he prepared himself for that. He put himself on the front lines, and what he's seen was not what they were telling us. He mentions that what he's seen statistically is that the deaths each year did not increase when COVID came to us, when COVID started to spread. The deaths did not change. He said if they did, it was marginally. And everything else was converted to a COVID-19 death. Heart attacks, strokes, all kinds of things. So we didn't see the death total, which is apparently provided to us. I haven't actually done that far into research looking at the statistics and breakdown of where the deaths are allotted per year. But what he has said is that those deaths that are allotted each year were nowhere. It was all COVID.
Yeah. So I actually, just to quickly touch on that, I have a very good friend of mine whose relative worked for the coroner doing autopsies here in British Columbia. And she said in her 35 years of working, she has never seen it where nobody came through that had died of a heart attack or cancer or old age, any natural causes. Everybody was already tagged when they came through as having been passed from COVID.
Mm-hmm.
Wow.
And I can honestly say, maybe I shouldn't say, I think I'll keep that bit to myself.
Yeah, let's be careful with where we go with
I will
this,
keep that bit to myself. But I can attest to what Arissa says, and I agree with that 100%.
Is at the end of the day, I don't want the 8 people who watch this to forward it on to somebody who's going to cost you a job or...
Well, I mean, we're already being cost a job.
Well, I know that, except it's not my fault. I don't want
It's not your fault. It's not at all. It's our own fault. It's our choices.
So I want to wrap this up, and again, I want to go to where you hope this will end up. And in the ideal world with Candace and Arissa, you've done a Facebook group and you're raising awareness. How does this end in your world?
Honestly, in our world, I'm hoping that if we can open up, if we can just open up a few more people's eyes to what's actually going on, I'll be happy. I'll be happy if people can start waking up.
I don't think that it's a very bright future for healthcare workers that have chosen what we have chosen. And unfortunately, I don't see that future getting brighter. I think that healthcare will continue to be mandated, and whether or not you feel you can stick it out, I mean, kudos if you have that option, and wait until maybe the sun shines another day. I don't honestly know how long that is. I don't see it being anytime soon.
Well, geez, I was hoping for something a little more upbeat.
I'm sorry, Dave. This is a dark sector of our lives, unfortunately. I mean, as happy as we might seem, and all smiles aside, I hold back tears some days, knowing what I know and knowing that my family has succumbed to pressure and are on the other side of the fence. I have had a good cry or two based on what I know. And I can't make choices for people. And that's what we've said. We cannot make choices for people. We respect everybody's choice in any circumstance. However, if we can give you information, if you haven't made that choice yet and are being pressured, we can provide information to you to make an educated choice, that one that you're comfortable with.
So on that note, I want to wrap up. I want to say for all of our viewers, all 7 of you now, and for the 11 who are going to watch the replay, you won't agree with everybody about this stuff. You really won't. So when you go out after the show or next morning, and when you go for coffee at Tim Hortons, hopefully
we're not allowed at Tim Hortons.
Drive-through.
Okay, when you go to drive-through and you get your coffee and you go to the park and you stay 6 feet apart.
Yeah, social distancing, Dave.
Listen to them and don't argue with them, even if they don't agree, guys. Listen.
Absolutely.
Have a conversation about the vaccine and the COVID thing and the deaths and the news on Global and the news on CBC and the news on what's the right-wing one in Canada? I know you have one.
Rebel News.
Rebel News, yes. Who named that?
We need to start supporting each other.
Yeah.
Despite our differences, it's literally tearing people apart, and we need to stop.
Tearing the country apart.
Yeah. We need to support one another.
Divide and conquer, Tim. Yep. Divide and conquer.
It's okay to be different, and it's okay to not agree.
Yep.
So on that note, I'm going to try to say William's line, stay safe and don't die.
Bye, everyone.